The next question, the Honourable Member Morel Mermaid.
Thank you, Mr. Speaker. Mr. Speaker, it's come to our attention that there was an urgent emergency memo sent out yesterday that details the lack of ER coverage at the Kings County Memorial Hospital in June. Can the Minister of Health confirm if this is true?
Honourable Minister of Health and Wellness.
Thank you very much, Mr. Speaker. And certainly over the past, I'll say, number of months, there has been situations at the Kings County Emergency Room, Mr. Speaker, where we haven't been able to provide physician coverage. I met with a room full of people a couple of Friday nights ago, and Dr. Campbell, Scott Campbell from the MacEwen area, he's an ER doc. He's a doc from that area, who met with the community to inform about a new process moving forward where there will be a triage of patients at a particular time in the day if the room has so many people in it, where the frontline staff, the nurses and the doctors will triage patients to determine the urgency of their illness, and if any that can come back the next day, they will be asked to do so. What we're trying to do is to provide sustainable ER coverage for the Kings County region. Obviously, there's a vast amount of population down there that we're trying to provide healthcare service to in a very effective way, Mr. Speaker. So this is a process that's been in place some time, and we're going to move forward with a new plan after today, June 1st.
Thank you, Minister. The Honourable Member Morel Mermaid.
Thank you, Mr. Speaker. Mr. Speaker, I don't hear of other places in PEI with this many closures, and I hope that the Minister knows how important this is to Eastern PEI. Mr. Speaker, I understand this memo details that we are lacking coverage on June 3rd, 4th, 5th, 9th, 11th, 12th, 16th, 18th, 19th, the 22nd, the 25th, the 26th, and the 29th of June, Mr. Speaker.
Holy smokes.
That's serious, Mr. Speaker. We don't have walk-in clinics down there, Mr. Speaker. Minister, what are we going to do to cover that amount of time?
Good question.
The Honourable Minister of Health and Wellness.
Thank you, Mr. Speaker. And in the past, there has been indicated days where physicians were unable to fill their requirement in the ER, Mr. Speaker. Obviously, physicians from other regions, from the Queens County region, have stepped up and covered those spots for those physicians from that area, Mr. Speaker. Obviously, the member has indicated a fair number of spots, but those are out the road, down into the future, Mr. Speaker. We will be dealing with other physicians from all over Prince Edward Island to determine if anybody can step up to fill in the need that are there. This is not a unique situation. We've had several in the past where there would have been a run of 3 or 4 or 5, but physicians stepped up to fill them in, and we might have ultimately ended up with one uncovered, Mr. Speaker. This is not uncommon, and I would anticipate that other physicians from other areas, including the QEH, will step up to fill most of those spots, Mr. Speaker. If not all.
The Honourable Member Morel Mermaid.
Thank you, Mr. Speaker. Mr. Speaker, it certainly isn't down the road. We're talking about Sunday, Monday, and Tuesday to start with. That's not down the road. That's this weekend. Mr. Speaker, I had mentioned before about scope of practice for pharmacists and looking at other options, and I hope the Minister is taking some of these suggestions to heart. Mr. Speaker, there is a nursing staff there at the Kings County Memorial Hospital that are going to be working these shifts. They're going to be there. We all know that nurses aren't using their full scope of practice either, Mr. Speaker. In fact, in Ontario, RNs are now prescribing medications as well. Mr. Speaker, is the Health Minister looking at expanding the scope of practice for the nurses down in MacEwen?
Honourable Minister of Health and Wellness.
Thank you very much, Mr. Speaker. And obviously, the situation that is in Kings County Memorial is unfortunate, Mr. Speaker. But obviously, at that meeting that night, Dr. Campbell talked about physician burnout. We don't want that to occur. Obviously, doctors are working significantly long shifts per day when they are on their ER duty, Mr. Speaker. So we're looking at adjusting those hours for those physicians so that it's not a 14-hour day. It will be a 7-hour coverage split in 2, Mr. Speaker. There was a lot of conversation that night about nurse practitioners being a potential possibility. There was also discussion on walk-in clinics as being being something that could be looked at down the road, Mr. Speaker. None of those options have been turned away or shut down, but currently, as of today, Mr. Speaker, we will be providing those split shifts for the ER physicians. We will be providing opportunities for frontline staff to triage those that their illness is not of an urgent nature that can come back tomorrow. They will be prioritized, Mr. Speaker. But all in all, it's about maintaining our physicians are not burnt out, our frontline staff is not burnt out, that when you go for your ER experience, you're being met by not exhausted doctors, by doctors that are well rested for your patient safety, Mr. Speaker. And it's something that we will continue to work on. This will be the first stage to see how this works out. But all options are still open. We're looking at everything, Mr. Speaker.
The Honourable Member, Morel Mermaid, your final question.
Thank you, Mr. Speaker. Mr. Speaker, there's no walk-in coverage in Surrey for the next 2 weeks. There's a nurse practitioner in Morel 1 day a week for the next 2 weeks. There's not, the ER is a lack of coverage. We know the percentage of non-emergency people that are going to the Montague ER because we don't have the physician coverage in the rest of Kings County. Mr. Speaker, the minister keeps talking about, it's hard to get doctors and they're meeting, this kind of stuff. We know sometimes that stuff's out of your control, but guess what's in your control? Guess what you can actually go and do as minister? You can work on the scope of practice of all these health professionals that we've been talking about. You can actually go and listen to our ideas here. You can listen to the professionals' ideas that they keep meeting with you all the time, and you can actually effect change that could change this right now and get these people the help they need if you take the leadership. Minister, will you take the leadership and do this?
The Honourable Minister of Health and Wellness.
Thank you, Mr. Speaker, and certainly I take my role as Minister of Health quite seriously, Mr. Speaker. I have met in the past and will continue to meet into the future with frontline RNs, frontline BNs, frontline LPNs. I've met with pharmacists, Mr. Speaker, about expanding scope of practice. Everybody is very passionate about the work they do that are working in the healthcare system now. All frontline staff have a primary focus on patient health, Mr. Speaker. I will continue those conversations to see where we can strengthen scope of practice for all frontline professionals, Mr. Speaker. Certainly we do. There are issues that are out of our control. That is for certain, Mr. Speaker, but we can work with the frontline people to determine how best we can provide safe, quality, efficient health care for all residents of Prince Edward Island, Mr. Speaker.
Thank you, Minister.